Hi, my name's Kevin Honan. I'm part of the internal medicine program here at UT Houston.
And my name is Salman Arain. I'm an interventional cardiologist at UT Houston.
And we'll be talking to you today about our case that's going to be in an upcoming issue of JACC's case reports titled Total Percutaneous Revascularization of the Hand to Treat Refractory Digital Ischemia in Advanced Scleroderma. So Dr. Arain, tell us a little bit more about the case.
So in this case, we describe a patient who has advanced scleroderma. She presented with Raynaud's phenomenon, had limb-threatening ischemia involving two of the digits on her right hand. This is a common finding in patients with advanced scleroderma with limited options. This particular patient had occlusion of both the ulnar and radial arteries. We knew this from a CT scan. And we decided to treat her with percutaneous revascularization using contemporary CTO techniques and stuff that we've learned from the peripheral arena. And to our surprise, we were not only able to treat both occlusions, we were able to promote wound healing, and she then went on to have complete wound healing and regained full use of her hand.
Just fantastic results. You know, you and I see these patients in cardiology clinic all the time, and how debilitating and painful this disease can be. You know, with the success that we've shown with percutaneous revascularization in the cath lab, like, where do you see this kind of taking the treatment of advanced scleroderma patients?
I think this is the start of something potentially quite revolutionary. I think many patients with scleroderma have vasculopathy, microangiopathy. It turns out that many of them actually have occlusions in the large vessels, such as the ulnar and or the radial. You know, we don't typically intervene on the hands in most patients. However, this shows that for patients who are refractory to the typical therapies, calcium channel blockers, anticoagulants, prostaglandin therapy, I think these patients may be candidate for revascularization as a means to promote wound healing. So I think this could be very big. There are many patients, young men and women, typically women in the 30s and 40s, who basically just have to give up their lifestyles because they can't use their hands.
Yeah, and the most exciting thing, you know, what can we expect in the future? Like, where do we go from here?
I think the next thing is to see if this can be done on an ongoing basis. I mean, we've done a few more cases, as you know. We don't have an interventional rheumatology clinic. It's something we'd like to start. And I'm hoping we can have enough cases to show that this can be done, when it should be done, to figure out whether there are other therapies that need to be done in addition to this procedure. And I'm quite optimistic that we will be able to offer something to hundreds, if not thousands, of patients who suffer with this every day.
Super cool. Well, there you have it. So on behalf of Dr. Arain, my name is Dr. Kevin Honan, and this is for JACC Case Reports.
Thank you, Kevin, and thank you, JACC.